one of the things that we have to do as a community is uplift survivors and to work to help them heal because we know that hurt people hurt people. And so can you talk a little bit about the work that Uplift is doing to help our communities heal?
Yes, absolutely. So Uplift provides free therapeutic grief support groups for kids as young as kindergarten and as old as high school, whether they're 18 or 21 when they graduate from high school, as well as their adult caregivers. So we're a little unique from a lot of different settings. First of all, we don't do individual therapy. All of our work is done in a group, like a therapeutic group format. And so the topic of grief lends itself to therapeutic group work in a really powerful way because grief can be so isolating. There's so much stigma, there's so much taboo around it. And a lot of times our kids feel like they're the only ones going through it. And when kids can feel less alone, all of their feelings and all of their grief is going to become more manageable when they feel like they can at least share it or connect with their peers on it.
One of the things that I do in my role as Lieutenant Governor is I chair the Pennsylvania Commission on Crime and Delinquency, and we administer the Violence Intervention and Prevention Funds. And you guys are a recipient of our VIP
for many
grants
years.
for many years. Can you talk about what that funding means to this organization and what it means to the community here in Philadelphia?
Oh my gosh, I feel like our funding means the whole world. So the amount of kids we're able to serve directly correlates to the amount of funding that we have. And so if we don't have enough funding to have the number of master's level clinicians that we need, that's directly like probably at least 800 kids that are not going to get grief support that year. And so right now we have a waiting list of about like 175 schools in the city of Philadelphia who would like a free in-school grief group from Uplift Center for Grieving Children that we're not able to get to. We spread our staff as far as we can without burning them out. We know vicarious trauma is very real, but we're not able to get to all of the places where we're wanted. And so every single day I hear like, do you have any more people that can get to my school or my rec center? I hear it all the time.
So, one of the things that Governor Shapiro and I have fought for every year is to increase the violence intervention and prevention dollars to make sure that we're taking a comprehensive approach to public safety here in the Commonwealth. And you guys, Uplift, is a recipient of VIP dollars. Can you talk about what that has done for your program and how it's benefited the people that you're serving?
As a nonprofit, we don't charge for any of our services, so we do have to heavily rely on grants, contracts. So the VIP funding is very instrumental on how we are able to just do our day-to-day. We currently have a 3-year contract with VIP, so that's over $200,000 a year that we can rely on. And especially since it's contracted year over year, we can plan accordingly.
When you're doing nonprofit work every year, you're trying to figure out how you're going to make budget, right?
Yeah, exactly.
And so I imagine having a stable commitment allows you to focus more on services, and then potentially broaden some of the services that you're.
So especially the type of funding that we applied for, we're able to see in maybe 3 years, maybe since this is secured, we might be able to hire another clinician. And with every clinician we hire, that's additional youth that we're able to support, and that just broadens our reach.
Can you talk to us a little bit about Uplift's HopeLine?
It's a toll-free number that is a helpline, warm line, not a crisis line, where our master level clinicians are answering the phone. Now it's during the week, 10 in the morning until 4 in the afternoon, Monday through Thursday. And we are able to connect people to our services. To dial this number, it's PHLHOPE. It couldn't be easier to remember. And we take calls from youth, counselors, any provider who's trying to connect their clients and patients with our services, as well as caregivers. Anybody, the word gets spread really well, I think.
If you could send one message to leaders in Harrisburg who appropriate funding for these programs every day, what would you say to them?
I would say grief is a thing that is, intangible, and it's not something anybody gets over. And it, as Catherine explained, it permeates so deeply into the outcomes for our youth and for families, and that it is critical to be able to provide these services at no charge. I want to encourage all the legislators to just recognize that these services for support, even though it's hard to measure, it's not like this many broken arms have been fixed or this many,
Yeah.
it's healing is happening,
Yeah.
and we can't do it without their help.